Hello and greetings from Boston, Massachusetts. My name is Prof Preston and I'm a pulmonologist and I direct the Pulmonary Hypertension Center at Tufts Medical Center in Boston. Thank you so much for inviting me to your annual conference. It's very exciting and I have the honor to participate. Today, my task will be to touch upon three very important aspects of life: exercise, sex, and contraception in pulmonary hypertension. So one of the questions that my patients ask me, is it safe to exercise? If it is, when should I exercise and how much? So let's talk about it. And I know it is a topic of great concern because not only from experience from my patients, but from a very recent study published in Pulmonary Circulation that looked at 19 patients with pulmonary hypertension from Ireland who were asked, why don't you exercise? The first answer from many of them was fear of overexertion. So this was the first problem that they raised. These are two quotes from the study. I would have always found that whenever I overdid it in terms of physical exertion, I would pay the price. I felt like I couldn't really do my exercise and live my life as normal at the same time, if that makes sense. Another one said, since being diagnosed with PAH, I tend to try and save my energy. I'm kind of like a phone. I use my phone battery or the battery in myself for my day-to-day activities. So they felt that they don't have enough energy to put it into exercise. The second fear is fear of physical damage. Do I hurt my heart and my lungs if I exercise? One quote, the worries that I was putting my heart under severe pressure by doing that walking long distance. Another one said, definitely not knowing. I hope it's not going to give me a heart attack. It's just how many do you do and when do you stop? And so I would just be afraid of heart problems or I'd get dizzy and could faint. I would be so nervous to do a workout as I don't know what to do. And those are very real concerns. The third problem was fear of breathlessness, becoming so breathless. It's the fear of getting really bad. It makes me so distressed. And then I'm trying to recover. You feel like you're going to drown. So these fears often stop our patients with pulmonary hypertension from even trying to exercise or be a little bit more active. And there are real concerns because if you look on the left-hand side with a normal heart and lungs, when people exercise, the heart rate goes up, the pump moves faster, right? And then it sends blood into the lungs. And what happens is vessels that are normally not used when we do not exert ourselves start opening up. That's called recruitment. So more vessels open up to accommodate this fast flow through the lungs. Now, in people who have pulmonary hypertension, there are less vessels available to recruit, and also those that they're narrowed. So the heart works harder when a patient with pulmonary hypertension exercises, and that is felt as breathlessness. So these concerns that have been raised by my patients and by patients in the study are very real. So we all understand that. However, even in patients with different forms of pulmonary hypertension, doing exercise is beneficial. It improves the function of the heart. It conditions the muscle. If you lift weights, your muscles get stronger in time. The same thing is with the heart. If you exercise the heart, the muscle of the heart gets stronger. It makes the blood flow easier through the lungs in a trained pulmonary hypertensive patient. It also improves the muscles. So you move with less effort from the muscles, because the muscles learn to use themselves and they buff up. And also, it was shown that all the molecules that are pro-inflammatory, that make the lungs, the muscles, the heart, the rest of the body stay in a state of chronic inflammation, these molecules come down with regular exercise. So it's not only beneficial for the lungs, but it's beneficial for the whole body. More so in patients with pulmonary hypertension who have lost some of the ability to exercise. So it is safe to exercise. Now, you have to start at low intensity and then go up to the moderate intensity. You have to feel a little short of breath. Remember, everybody who does exercise feels short of breath because we breathe fast. The idea is to listen to your body's signals and make sure that the breathlessness is not very severe. So definitely avoid the point of feeling dizzy or lightheaded. Stop before. And that's why you need to start low, so you can learn your body's signals of when to slow down and when to stop. Now, ideally, you should start in a supervised exercise program if it is available, but with a COVID situation in the United States, these programs, the vast majority of them were closed out and they have not reopened. So I recommend have an exercise buddy. Do it with a friend or with family at the same time. And be patient. Give time to your body and muscles to increase their endurance. Pick the time of the day when you feel more energetic. And I would say start twice a week, slow and steady and without fear, because it is one form of treatment. It's not only pills, it's not only infusions, it's not only medication, but exercise is one form of therapy. So put your sneakers on. All right, second question. Is it safe to have sex? If it is, when? And should I be worried about anything? And these are very valid questions again. Now, I don't want to minimize the importance of sex because it is a very important aspect of our lives. However, think about it. If we are to minimize it, sex is a bona fide exercise. So if you can have exercise, you can have sex. Now, it is important that good communication with your partner be part of a good sex life, and be open and honest about what pleases you, what doesn't please you, and how much exercise and exertion you can do. Of course, you may have days when you feel fatigued and more breathless, and those are days that maybe it's not a good time for sex. But pick days when you have more energy. And if you are on inhaled therapy, those are more shorter acting. Plan to take inhalational therapy before sex. If you use oxygen, you may find it that just taking it just before for half an hour or so may give you a little more energy. And again, don't be afraid to let your partner know the times when you're feeling your best, whether it's in the morning sometimes, whether it's in early afternoon, and do know your limits. And that's why it's important to exercise, because that tells you your limits, and that will tell you your limits during sex. And definitely stop if you're short of breath severely or if you feel frightened. Now, things to consider. There are several medicines such as prostacyclins. That means you may have to wear a pump and a catheter. So you have to be cognizant of not pulling the catheter during sex, right? I listened to a patient at our PHAE association a few years back, and she said, oh, we have 3 kids, so we go in the basement so they can't find us. and I have a pole, and what she was saying, I have a pole and I put my oxygen canister down, but I put my Flowland, she was on Flowland pump hooked to the pole, so it's out, out of reach, and it doesn't, get tangled. So sometimes we do need to be a little more inventive to work with what we need to work with, right? Some medications can cause nausea and headache, sometimes palpitation. So if you're on a medication that needs to be up-titrated in the up-titration phase, make sure you don't plan anything the day that you go up. Or if you tolerate it, no problem. All right, sexual positions. So some positions may be difficult for the PAH patient or uncomfortable. So it's important to avoid heavy pressure on your chest or put weight on your chest. For example, the missionary position may not be a good choice unless you take some necessary steps to support the weight of the person on top of the PAH patient. And, different sexual positions, I think they apply in the same way for both heterosexual as well as same-sex couples. So the idea is not to make the work harder for the PAH patient. These are some positions that you may want to consider. Seated with a receptive partner on top, or lying down with the receptive partner sitting on top, both lying on the sides, and so on. So I think it's important to experiment and to feel what not only pleases you, but makes your life easier. So putting it all together, have sex in a position that is comfortable and more relaxed for both you and your partner, and avoid weight on the chest area. Experiment new sexual positions that work for you. Have sex when you're feeling at your best, even if it isn't at a time that would normally be described as bedtime. You can use pillows and roll up duvets to support yourself or your partner during sex. Lubricants, absolutely very safe to use. Most have very safe ingredients, at least all that I've seen that my patients ask me about also. So do use, especially, if some of our patients, if they're postmenopausal, or if scleroderma can make the mucosa less moist, you can use lubricants. And remember, there's far more to sex than just intercourse. And there are many other ways to enjoy sex that may not involve actual penetration. And talk about it openly and honestly with your partner. And if you're clear about what you like, you never know. All right, question number 3. Is it a myth that pregnancy is dangerous if you have PAH? The short answer is no, it's not a myth. Because pregnancy is among the several triggers that can worsen pulmonary hypertension and put patients into heart failure. So the problem is that PAH adds to the physiologic demands of pregnancy and birth itself. If you think about exercise, pregnancy is a state of continuous exercise for 9 months for the mother, because she has to feed and push the blood to circulate for 2 people, herself and the little one. But the blood volume doubles, and it peaks in the second trimester of pregnancy. So it puts a whole lot of pressure on the heart. There is a high maternal mortality associated with PAH in pregnancy, and often occurs during or shortly after childbirth. And If the mother and the child survive, PAH can get much worse after pregnancy and can change from a stable, mild disease to a very accelerated malignant course. So even if they go through pregnancy, there's a very high risk that PAH will get worse in the months to come. So it's true that there are some reports of good outcomes in pregnant patients with PAH who have had a very stable PAH under control with medications, but there are very few, and actually pregnancy in PAH is a condition where medical abortion is indicated. So you need to use contraception. If you want to exercise, if you want to have sex, and you have a risk of getting pregnant as a woman with PAH, we need to consider strongly good methods of contraception. Again, this is the reported mortality between 17 and 56%. And if you become pregnant, your pulmonary hypertension should be treated by a multidisciplinary team in an expert center. Now, there are some drugs for PAH, such as endothelin receptor antagonists and riociguat, and also the warfarin, which is a blood thinner that cannot be used during pregnancy because it causes birth defects. So in the case of a pregnant PAH patient, all these three types of medications absolutely are contraindicated. Now, this is a table from a review article that I was co-author on that reviewed what's best as efficacy of contraception method. And if you look at the table, the diaphragms have a high failure rate, and they're harder to use correctly. But if you go down, the intrauterine devices, what we call IUDs, are actually the best way for long-term contraception. And that's what I recommend to my female PAH patients. The progesterone implants or the Mirena, not as much the copper, we don't use it anymore because they're a little clunkier and bigger. But the ones that are impregnated with very low levels of hormones are very effective or very safe, and they're easy to use. You implant them. Now, of course, female sterilization with tubal ligation, it's an option. But to be honest with you, if you are in a stable relationship and your male partner is willing, male vasectomy is a very, very good method of contraception, totally safe for the woman, and with extremely low failure rates. So intrauterine devices are safe, quick to place, and effective. They should be removed if there's excessive bleeding. At the time of implantation, the woman needs to take antibiotics. And again, a female sterilization with tubal ligation is an acceptable alternative, but it requires a surgical intervention. And what I usually do is, if in case there's a pregnant patient after her C-section, then the surgical team, the GYN team, does the tubal ligation. So that's probably the only time I've recommended tubal ligation in my patients. All right, so conclusions for contraception. PAH carries significant risks for a woman if she becomes pregnant. The mortality is high, is unacceptably high. We don't know how to manage. We don't have means to manage our PAH patients during and after pregnancy. There are several barrier contraceptive methods that are very safe to use long-term. And then be aware, some pulmonary hypertension medications are known to cause birth defects and are contraindicated in pregnancy. So summing up, it is benefic to exercise. It helps the pulmonary hypertension. It helps the rest of the body. Start safely and increase the level of exercise safely. Monitor yourself. Have somebody else monitor you. For example, if you use activity devices, that they can be useful. Reminders are useful. Sex is also benefic. The level of exertion during exercise can inform about the level of exertion during sex. And please, please, please use contraception. I thank you so much for listening, and I look forward to our live meeting and your questions.
I would like to welcome you all to this session. This, I think, will be a very interesting session with Q&As because this was the session that received the most questions. And we've been very lucky today to have Professor Preston with us today. And you originally come from Europe, don't you? And you ended up in the States.
Yes, Hal, I'm Romanian of origin, grew up in Romania, so I identify with Europe very much, and I still have strong ties with Europe. So thank you for inviting me. It is a pleasure and an honor to be at this session.
Well, the honor is really on our side, and it's we're really lucky to be able to have a specialist like you talking to us. So thank you so much. Do you want to maybe have one word of introduction of yourself?
Of course, I'm a pulmonologist. I went to medical school back home in Bucharest, Romania, and then I trained in the US in my internal medicine residency and pulmonary and critical care fellowship at Brown University in Providence, Rhode Island. And then after my training, I moved to Tufts Medical Center, and I've been a pulmonologist and a PAH specialist since 2003, working at Tufts. And I currently direct the PAH Center at Tufts Medical Center.
And your topic is exercise, sex, and contraception. So I think we should just dive into the questions right away. And first one is actually from me, and I'm asking for a friend. Can sildenafil taken 3 times a day increase the sex drive?
It's an excellent question, Hal. Sildenafil and any PDE5 inhibitors do not increase the sex drive. They increase the performance of men who take PDE5 inhibitors. So the drive has to be there for the drug to work as an ED enhancement medication. And that's for men. For women, it does not seem to have the same beneficial effects on sex performance as it does in men. We women seem to be a little bit more complicated.
Yeah, we men are very simple, you know.
For better or for worse.
You know, I'm often asked these questions by friends and so on, and how it works, and my response is I really don't notice anything. And maybe it also is because the PH medication is 20 and 25 milligrams, and if you have other problems, you take stronger pills, or?
No, I don't think so. I think 20 milligrams 3 times a day, if it's taken by a PH male, and I probably it enhances the vasodilation and the engorgement of the penis. So the performance of the male person, whether he has or not PAH, is probably better than without it. However, the drive has to come from within. And then for women with PAH, because we know from people, from women without PAH, sildenafil has not shown any beneficial effects on drive and performance during sex, it's probably not doing much.
I guess if things work okay before and you start to take and notice no change, it's that's just the way it is.
Correct.
Another question asked by my friend, or this is more like a statement: exercise is good for a PAH patient, sex is good form of exercise. So the conclusion is very simple: PAH patients should have frequent sex. Isn't that correct?
Well, I think everyone should have some form of intimacy. We are social creatures, social animals, if you would. So being intimate with your partner or with someone enhances the mood and makes you feel better. So there's nothing wrong about sex, whether you do have PAH or not.
Some PAH women have a strong urge to give birth to a child despite the danger. How can one best persuade them not to get pregnant?
Yes, yes. And we women go through this period of time. And, I can speak as a woman, not only as a doctor, where we feel the motherhood is knocking on the door and is a very, very strong and emotional impetus to become mothers. Because women who have PAH through pregnancy and after pregnancy, there's a very high risk not only of death, but also of worsening pulmonary hypertension. It's a contraindication to become pregnant yourself. So that having said, even though there are more complex options, I think, anywhere from adoption to surrogate mother to donating your own eggs and having a surrogate mother, or having your partner in vitro fertilize someone who can carry a pregnancy for you, are all, I think, very valid options. It's not as simple as getting pregnant yourself. But I think these options need to be strongly considered because of the risk. God forbid you get pregnant and you don't survive and the kid survives. What happened to that kid? Will you be at terms with that situation? I think the most important aspect from healthcare people like myself is to keep our patients well and alive and enjoy life. And if you can work with your pulmonary hypertension physician and with your obstetrician to find solutions outside yourself becoming pregnant, I think it's the best option. I can hear you, Hall, but I get the question. So what about swimming? And we got several questions about swimming and the types of exercises that PH patients should engage into. So swimming is a whole body exercise. It implies a more effort than other types of exercises, not because the water puts a strength pressure on your chest, but because it involves whole body exercise at the same time. So my recommendation is, if you were a swimmer before, I think it's a very fine to engage in swimming as a PH patient while you're in therapy and everything is under control, and go slow and feel your body, because it will give you signals when to stop or to slow down. Now, Water exercises, on the other hand, for those who are not avid swimmers, like I am, I'm a terrible swimmer. So when I go into the pool, my effort to swimming is unbelievable because I'm not very efficient and I'm not technically correct. So if I had PAH, I would definitely not go swimming because I don't know how to swim correctly. But water exercises, aerobic exercises, are amazingly well and they're doing really well for the body because the body has a buoyancy and it feels lighter when you're in the water. So the movements, although they have a little bit of resistance from the water, the body is lighter. So I strongly recommend water aerobic exercises in classes, with the condition that if you feel terribly short breath, you got to slow down or stop. If you feel lightheaded, that's definitely a little bit too much. So don't get to the point where you feel lightheaded, but water exercises are a thumbs up. Okay, somebody from Bulgaria, my neighbors. Is it true that certain therapies used for PAH can reduce the effect of contraception? And it is true for bosentan. It has not been shown with any other medical therapies. Bosentan decreases the effect of oral contraceptives. However, as we're going to go down on the questions, oral contraceptives are probably not the best way to prevent a pregnancy in PAH women. All right, another question from Bulgaria. Is an individual approach required for applying contraceptives to women with PAH? Absolutely. Absolutely. Depending on the age of the patient, on the partnership that this woman, PAH patient, has, it depends. The best and the safest method is a vasectomy. So if you are in a long-term relation, your husband is willing to do it, I think vasectomy is the safest way to go. If vasectomy is not an option, then in my patients who can become pregnant, I usually offer intrauterine devices. Because they're very safe, they confer long-term protection with minimal, thinking, I have to take a pill and whatnot. And they are impregnated with very low hormones that are not known to affect the body on its own. The oral contraceptives have estrogen hormones, and we know from the large population studies that do not have PAH that at the beginning of the treatment with oral contraceptives that contain estrogen, there's a risk of pulmonary emboli or clots in the lungs, especially in women who are overweight, and especially in the first 4 months. So this procoagulant effect makes us PAH physicians very worried to use oral contraceptives in PAH patients. There are only estrogen-free oral contraceptives or implants, like in the US, it's called Norplant. It's only progesterone. So only progesterone supplements, whether they're pills or implantable devices, are safe to be used if an IUD is not an option. Oh, absolutely, it's a myth. PAH patients, whether they're women or men, they're women or men. And like all people in this world, we can be sexually active as PAH patients. It's true, especially with women, that, you know, the sexual activity, drive, orgasm, and all these very intimate feelings go also through the brain. And our brain may suppress these urges and these feelings and emotional connections. So I think that's where we have to work with to become more open to this topic and this part of our lives. But that is a total myth that PAH patients are not sexually active. They are, and I can guarantee on my patients.
Can you hear me now, for instance?
Yes, I can. Yes, you're
Oh,
right.
okay, good.
Yes.
I guess it's like you said before, maybe women are a little more complicated with issues like this than men.
You know, it's yin and yang. You know, we cannot be without each other. So, you know,
Exactly.
it's a very nice compliment in the world.
What was the age of the oldest pregnant woman with PH? Got pregnant
Well,
after diagnosed with
yeah,
PH?
I don't know. I don't know, because unfortunately, we as medical caregivers do not report poor outcomes. We typically report, yay, we did it well, you know, we got a PH patient through pregnancy. It's not necessarily the age of the PH patient, female patient who gets pregnant, but the severity of the PH disease. And even when the PH is not very severe, throughout pregnancy, because the blood volume doubles, so the heart pumps twice as much, even at rest. I'm not talking about exercise, but at rest, it pumps twice as heavily as normal. And on top of that, there are the hormones throughout the pregnancy that are a lot of estrogen that probably may accelerate the disease. And if the PH mother goes through pregnancy and everything is safe, there's a very high risk that after the pregnancy, the disease can become in an accelerated course and get much worse over the following months. And that's the worry, the pregnancy and after pregnancy, that is associated with worsening, severe worsening of the disease, unable to be handled by the medications that we have many times, and then a demise.
This thing about hormones and women and men, it's interesting because there are more women than men that have PH. Do you think it might be related to hormones?
I think it's unquestionable that is related to female hormones or female makeup or X chromosome. I don't know exactly. We don't know in the science. We have not discovered exactly what it is. However, men who have PAH seem to do worse than women who have PAH. And I really don't know if it's a true more severe disease, or the fact that there are so few men who have been studied compared to a larger cohort of women. And then the statistics sometimes can lie and tell us that. But if you look at all other diseases, cardiovascular diseases in particular, men seem to do worse than women, even though in some conditions women there are more women who get the disease than men.
I guess I feel lucky. I've been doing quite well.
That's wonderful, Hal. Good to hear.
Yeah, but also with men, maybe it has something to do with lifestyle and things like this.
Could be, but I think it's more in the genetics.
Yeah, okay. Another question from Slovakia. Do you recommend to finish pregnancy abortion when it is accidental that they get pregnant, I guess?
Yeah, so it's a very personal. So in the first trimester, and depending on the state and the country laws, if it's early in pregnancy in the US, we recommend medical abortion in a PAH patient. If the pregnancy is far out, and we have had patients who presented in the second and third trimester with newly diagnosed PAH, it's not lawful to terminate the pregnancy, but what we can do is we can offer the best treatment and the safest treatment for both the mother and the baby to get the woman through the pregnancy.
Portugal, what is the probability of a patient with heritable PH to have children with the same disease?
Yes, so that's an absolutely great question. So it is reported that, so we know that the most common genetic mutation or defect is in a molecule called bone morphogenetic protein receptor 2. It's a funny name, but actually it has a big role not only in the bone, but also in the heart and the blood vessel development in the baby. So we know that the majority of patients with hereditary PAH have this mutation that makes this molecule not work well. There are other mutations in other molecules or proteins that are actually linked with the same pathway in the BMPR2 pathway. That we don't know as much, but the most common mutation rests on this molecule called BMPR2. So we know that patients who have BMPR2 mutation, in those patients, their offsprings have a higher risk of developing PAH than the regular population. And the risk is 14% if the offspring is a male kid, and 42% if the offspring is a female kid, so a girl. So it's tremendously high, especially if it's a girl. It's not 100%. So having a mutation inherited from your parent doesn't give you 100% risk of developing the disease, but it is quite high.
If you have this mutation and you're not sick, should you take precaution not to do, for instance, extreme sports and go on high altitude and things like this?
Yeah. So currently, the most research and care that we've learned from is the group from France and from Paris. And what they do is once they identify patients with hereditary PAH, they grab all their family and they follow them. So I think the safest way, once you show that you have a mutation from somebody in your family who has PAH, is to follow with a PAH center. And typically they do echocardiogram, maybe exercise tests and whatnot. However, you should follow your life and live your life fully, because even though it's a high risk of developing PAH, the more chances is not that you're not going to develop PAH. So don't feel it as a burden. Feel it as a chore that you should follow carefully, but exercise, do whatever you feel, and live your life.
Another question from Portugal: what kind of precautions should patients have during sex?
Well, I think there are two things that are very important. One, for a PAH woman, do not get pregnant. And then second, for both PAH women and men, make sure that level of exercise and exertion during sex is not to the point where you really can't breathe. So you have to know your exercise limitations and apply them during sex.
I guess the problem could be that you get a little carried away or something.
Oh, absolutely, absolutely. And there are ways to get by and to teach your partner, whether it's heterosexual partner or same-sex partner, it doesn't matter, how to give you the space to slow down if you need to, or catch your breath, or change positions so it's not very heavy on your chest if you feel too much pressure.
Yeah, I guess you talked about this in your talk, how maybe it's a little hard for a woman who is PH in a normal missionary position, that it
Yeah.
might be a little heavy. Finland, the heart needs to pump faster, but if it pumps faster every little movement, I'm not quite sure what she means, but maybe that whatever she does, she feels the heart is pumping faster.
Yeah, so I think he or she is referring to my quote during pregnancy, because the blood volume doubles, then the heart needs to pump faster. And it does. It has to do double the work at rest, to pump the double volume of the blood throughout the body and the fetus and the placenta. But I don't think it's only that. I think it's a lot about the hormones that are circulating in the body that make things even worse.
What if I got very high breathlessness only on walking slowly?
So how do you exercise when you do that? And how do you have sex when you do that, right? And it's again, learning how much your body can do and listening to the signals. And if you do a slow walk, I think once you're on therapy, even though our therapies are not curative, they make things a little bit better sometimes, much more other times. But if they do a little bit better and they give you a little bit of room to exercise, if you do slow walking and increase your slow walking slowly and carefully. And that's how you build a little bit of endurance, because once you start building endurance, the muscles will need less help from the heart to make the body move. If the muscles are deconditioned, they have to put a lot of effort. They need a lot of energy. They need a lot of blood for you to move. So it's a lot of work from the heart. So you have to condition the muscles to have less work. And that's a stepwise approach. You do 5 minutes of walk, do 5 minute walk for the month, and then do 12 or 13 minutes of walk the next month. And then go slowly, and your body will signal you when you have to slow down or stop. It will tell you.
And I guess this is really important, to listen to your body. And as a PH patient, I know that some days can be good and others can be tougher. So take it easy those days where it's a little hard, and you can do more when you feel good.
Absolutely, Hall.
Spain, some of us have a yoga program for our members. Do you think that practicing yoga is a good way to start exercising for PAH patients?
That's a great question. So, yoga is not only exercise and strengthening, is also meditation. So it's a more of a holistic approach. And I love this approach. Now, if you've never done yoga, there are some positions with a head down, with the body putting a lot of strain on the upper body, which typically is less strong than the lower body, right? Our legs are stronger. That may make a very difficult yoga to be performed by a PAH patient. So I would go very cautiously during a yoga program. It's fine to do it, but remember, with a head down, it may be a little, it make you dizzy and lightheaded and too much. So if you do yoga, it has to be a very mild program. And if you go into a program, you can skip some of the positions that you feel they're very strenuous on your body.
Another question from Spain. If you have had sex without using contraception, is it safe to use the morning after pill in patients with PAH?
Yeah, very, very good question. So, the morning after pill has a lot of estrogen and progesterone, and it basically forces a very, very, very early abortion. So to expel if there is an egg that is there, that to be expelled. Even though it's a hormonal pill, it's a one-time dose that I do not think, and there's no data that affects the long-term outcome of PAH. So given the small risk of a one dose of hormone versus a higher risk of a pregnancy, I would go for the morning after pill, and I would advise my patient to take it as long as it doesn't happen too often.
Gurgly asks, the human body usually gets used to the workload. Do you have any data whether making exercises rather contributes to a better condition than just avoiding clinical worsening?
Yes. And the question is yes. There are data mostly from Europe, a lot of them from Germany and Netherlands, that shows that doing regular exercise that builds muscle endurance and tone improves the feel and function of our PAH patients much more in some instances than the drugs that we use. So if you do it on a regular basis, it may be more beneficial than the medications. Now, medications lower the pressures, so give you the space for the heart and the lungs to start exercising. But doing the exercise improves the muscle tone, and I think indirectly it helps the heart and the lungs to function with less effort.
So a combination of exercise and drugs sounds perfect.
Yes.
Gurgly again, pregnancy is contraindicated for PH patients. On the slide of a couple of old papers were referred. However, many new data were published most recently about favorable outcomes. Do you see any shift in the general approach understanding?
It's a very good question. Now, we physicians and scientists and clinicians are very biased in reporting good outcomes. We tend not to report bad outcomes. So what you see published is the good side of the coin. I don't think there's a change in the outcome of our PH patients. Maybe, a little bit of tweaking during a delivery, because we've learned how to handle a little bit better compared to maybe 20 years ago. But overall, the risk of worsening the disease in the mother with PAH is the same. We haven't made any, important strikes. So there's no shift in the general approach and understanding. What you've seen published recently, and actually I was a co-author on a review paper of how to handle pregnancy in PAH, is if this happens and the patient is in the second or third trimester and we cannot have an abortion, how can we handle the best of care for that particular pregnant patient?
Spain, how and when is it advisable to practice safe sex with pulmonary hypertension without the fear of syncope on exertion?
On a good day, on a good time of the day. So as Paul said, you have good days and bad days, and everyone has good days and bad days. Now, how much should you push yourself and exert yourself during sex? If you're super worried, I think one approach is to do initially maybe, and then I'm totally open, and I talk to you like with my patients, like with my friends. Do self-stimulation and see how much shortness of breath you develop when you're by yourself with yourself, and that will give you a clue of how much you can enjoy intimacy with your partner, and build on that, and step by step, and again, safe, but try it.
Well, thank you for being so frank and open. It's really nice to be able to talk about these things. And actually, I've had PH in 2005, and I never heard anyone talk about this. So it's great. Spain again, how to improve it to avoid hemodynamic collapse during due to overexertion. I guess it refers to the previous question.
Yes. So again, I think listen to your body. Everybody who does exercises are short of breath, no matter whether they have PAH or not. Now, if you do have PAH, your level of dyspnea or shortness of breath with exercise should be mild to moderate. And that will make you avoid getting to the point where it's risky to pass out. Sometimes, based on your age, you can put the heart rate maximal limit for aerobic exercise, and you can bring it down by 20 to 30% and make sure you don't go over that limit. But I think the most important thing is to listen to your body and feel. If you're too short of breath, you got to slow down. If you're terribly short of breath, you got to stop, catch your breath, and then pick up later,
Spain again, when will we know when we have to stop, and how to know how our limit is before exercising so that it is safe and we do not put ourselves at risk?
Yes. And then that's linked with a previous question. In this day and age, and in some parts of the world, there are no supervised exercise programs available. And during the COVID and after COVID, these programs also have been shut down, even in the US. So we've been struggling of how to make sure that our patients exercise, but they're doing it safely. My advice to my patients is to try to exercise with a body, with a friend, with a family. Even on the iPhone or on the phone, you put it, on FaceTime, and you and your friend are exercising, each of you at home, but at least you're in contact with somebody. Because just in case, if you feel like you're going to pass out, you tell that person, oh my God, I need to pass out. And that person will tell you, oh, stop, let's stop. So it's a good feedback. It's like there are certain exercises, like, more advanced exercises, like diving, where you never go in the water unless you have a body. You have a friend and then you dive together, because deep in the water, you're never safe by yourself. So one way to exercise on the surface as a PH patient is to do it with a friend or with a partner.
And I guess also is to start with very low exercise, and then you can try to experiment and increase maybe a little bit at a time.
Exactly. And do it stepwise. If you haven't exercised in at least a couple of years, you got to go slow. Walking is a very good exercise. It's an amazing exercise, whether it's on a treadmill or whether it's outside. It's a wonderful whole body exercise. Then light weights, maybe 1 pound or half a kilogram weight, or a bottle of whatever you have in the fridge, do in one arm at a time. And then the other thing I think is stretching is amazing way to start using the muscles.
Yeah, I was just going to say that even healthy people, if they don't exercise, they get out of shape. And with us PS patient, maybe we have the disease, and in addition, we are afraid of exercise, so you get double out of shape because of the pH plus that you don't exercise. So that's why it's important just to take it real slow, I guess.
Absolutely, Hal. You're absolutely right.
Question from Hungary. Is there a type of sport that is especially recommended, or is there one that is contraindicated? For example, what is your opinion about swimming? Yeah, you talked about swimming before.
We talked a little bit about swimming. So swimming, if you've been a good swimmer before, it's fine to take it slowly and go back swimming. If you've never swum before, I don't think it's the type of exercise that's effective for you, just because when you're in the water and you don't know how to swim efficiently, it's a lot of work. Water aerobics, as I mentioned, light weights, and sometimes focusing on different parts of the muscles. So focused training, let's say, you decide to do twice a week exercise. One day you do upper body. So you do light weights and stretching of the upper body. And the next day you do legs and lower or abdomen and stretching of that part. So focusing on the different parts of the body, it's another way to approach strengthening and exercising and building tone and endurance. And then again, walking is fantastic.
Another question from Hungary. Is there any other parameter like heart rate, blood pressure, that is a warning sign that you are overdoing the training and should stop before a stronger breathlessness or coughing manifests? For example, stronger heartbeat or stronger pain in the, what is this, nape?
Nape is the neck, is the back of the neck right here.
Ah, okay. Can be the sign of overexertion?
I think the most important is breathlessness and fatigue. And you don't need to watch your heart rate. You don't need to watch your oxygen level by finger, because your body will signal you when it's too much for your level of training.
I guess in my case, what I notice if I overexert myself is that I start to have extra beats. I can feel my heart is beating some irregular beats. And also I get a little burning sensation in the lungs, and then I know now it's too much.
Okay, yeah. Burning, pressure, pain in the chest or chest and neck, that means that it was a little bit too much. So you got to take it slower. Go down a notch. Do a little bit less intense exercise.
And another thing I notice is if I overdo one day, then the next day I have a lot of fatigue.
Yes.
And then I understand, okay, I did too much yesterday.
That's a very good signal, Hal. Absolutely.
Courageous, first of all, thank you for an interesting presentation. I can personally testify to your claims that exercise is beneficial for PH patients. Personally, I practice yoga and walk longer walks, 7-8 kilometers. Wow.
That's
They're
a
not
good
a problem
walk.
for me. Yes. And I'm quite physically active. What I want to ask is, do you recommend that I try stronger, heavier exercises in the gym? Like most patients, I feel a certain fear of it, so I haven't tried it.
I think you're doing fantastic. Yoga, it is a whole body exercise. So it puts a lot of, it requires a lot of strength and tone. So I congratulate you for that. And also quite longer walks. Absolutely, you can dial up a notch slowly and carefully. And if you go to the gym and you do a treadmill and you want to do a treadmill training, you can put a little incline more than you've been doing, not much more. Do it a little bit and see how you feel. You can dial up a notch, but one notch at a time, and listen to the body signals, shortness of breath, skip beats, pain, really heaviness in the chest. That means that it's too much. So you got to go a little bit lower.
Another question from Croatia. Also, how do you convince patients that they need to be active, even though it's difficult for them to get started and start exercise at first?
Yes. So for our PH association and for our educational, needs in the US, we've created little video pamphlets that we show to the patients and encourage them to do several things, such as exercise. And again, assure them that they're going to be safe. If there's no supervised exercise, if they can do it with somebody next to them, is a good test, and I think they will be more welcome to trying it. Also, during the 6-minute walk test that we do in our outpatient clinic, we show the patient how much they walked, and we tell them, you walked that far, then that means that you can do 6 minutes of light exercise by walking either outside or in the home or on a treadmill. Do start with walking, and I think that's the first step. Many of our patients, although not all, have smartwatches, and we engage in measuring how many steps they do during the day, and if they can increase, let's say, the following month by 15%, it's a good increase, but not too much. So that's a good encouragement to make them move more.
Also, do you recommend lymphatic drainage to your patient? I don't know what that is.
Well, I do know. And actually, Indian medicine, what they call it, Ayurvedic medicine, that's been established for thousands of years, even before we, Western Europeans or Eastern Europeans or even the US started
we had a
anything.
presentation about this earlier.
Right. Has advocated lymphatic drainage. And I think it's a good holistic approach to toning the body and helping getting rid of the toxins. For the legs, because the legs, work against gravity, right? So they always go down. Keeping the legs up for maybe 10 to 15 minutes, and you can put them up on the wall to let the lymphatic drain of the legs. I think it's very useful because it's above the heart, the level of the heart. So the drainage of the blood flow and the lymphatic system is very efficient. Then during the shower, if you have a towel that's a little rougher, and then you massage the body with the legs towards the heart, the arms towards the heart, and the rest of the body to massage it from the outside with a little rougher towel, also helps drain the lymphatic system.
It is known that hormone therapy can cause clots, which are one of the reasons for the formation of pulmonary emboli. Why do you still suggest hormone therapy to patients with PH?
So what I recommend is if it's pill or implant, is estrogen-free hormonal therapy, only progesterone. So stay away from the estrogen progesterone combination pills. The second is the intrauterine devices. They are coated with very low levels of combination hormones, but they're very low levels, and they have not been shown to increase the risk of clots. So they're safe, very safe as contraception, and safe to use in our PH patients.
Another question from Slovenia. Does a child with PH idiopathic disease progress during puberty? Are more frequent controls recommended?
So traditionally, we've learned that idiopathic PAH from childhood has a better outcome than in adults with idiopathic PAH. So they tend to do much better and live longer. And then there are new and newer therapies that are coming on, and I think overall, in general, even though it may progress, it may not progress as fast as in an adult. Overall, the outcomes are much better. There are certain kids who do develop severe disease and need transplant and advanced therapies, but overall, the outcome is much better than in adults.
Another from Slovenia. Do you think that infections with COVID affect the worsening in children with PH?
What we've learned, it's a very interesting, is that not a whole lot of patients with PAH, whether adults or kids, have been infected with COVID. And if they had, the course of the infection is not very severe in most of the patients. So it's very interesting, and I don't know the answer to that, whether our PH patients or if their kids, their families are smarter and cognizant and more aware and not be exposed unnecessarily to the disease. So they're more cautious to catching the disease. Or whether the medications that we use for PAH may confer a protection against COVID. There's some data that suggests that, although it's not clear. But all in all, it seems that our PH patients worldwide have done pretty well during the pandemic. Kudos to them.
Yeah. How often should you do an exercise a week? I guess we talked about this before.
Yeah, so I think I would start with twice a week.
Hmm.
Not too much, not too often, but I think once a week is not enough to build the strength. Twice a week, and depends on your level that you start. You may start 5 minutes twice a week or 10 minutes twice a week. Listen to your body, know where you start from. Talk to your doctor because they may suggest the level. Talk to them about, your 6-minute walk distance. If you have a smartwatch, see how much you move at baseline and try to increase.
I guess this thing about exercise also, many patients and people, when they think about exercise, they think about strenuous, hard exercise. But just like you say, just walking and maybe take the steps instead of the escalator and so on. All this are exercise that adds up and is beneficial for us.
Absolutely. If the weather is nice, maybe do a walk rather than drive to a store that's close by. Or if you drive, don't park the closest to the store entrance. Park a little bit further so you do the parking lot walk. Find yourself ways to trick your body to move more.
Does it make sense to work with an expert at the beginning? I guess this is referred to this exercise, if it makes sense to work with experts.
Yeah, I think the best is to work with an expert or in an exercise program that's supervised by healthcare. However, these avenues are so limited nowadays in all over the world that I think we shouldn't wait for that to happen. And but talk to your doctor. Definitely talk to your doctor. But I don't think we are in a position to wait for a supervised exercise program because I don't foresee this happening on a regular basis.
I see time is running out, but we still have a few questions.
All right.
In your opinion, would it be better to do smaller, easier workout unattended by a physician or not to do any workouts at all until all needed conditions are met? For instance, in countries where you don't have PH center. Boston and Herzegovina ask about this.
Yeah, so in my opinion, I don't think we should wait. I think, again, starting slow, safe, building up on it is the way to go.
Another question from Boston and Herzegovina. Do you know how much hormones such as sex hormones, thyroid gland hormones can exacerbate pH?
Yes. So, I mean, we know that estrogen hormones in the setting of hormone replacement therapy or oral contraceptives have a procoagulant effect, so it may exacerbate pH. We don't have real data on it, but because of the literature in non-PH patients, in regular adults, suggests that we are very wary of using them. The thyroid gland is very interesting because up to 20% of women or patients who have PAH may have a thyroid problem. So we do a thyroid screen in all our PAH patients or patients who we suspect of pulmonary hypertension. And that's very important because if the thyroid gland is overactive, it can increase the blood flow and make things feel worse. If it's underactive, the heart is weaker and it may feel things worse. And once you set up the thyroid replacement to the level that the body needs, things go back to normal. I don't know if they worsen in the long-term PH, but they definitely can exacerbate the symptoms of pulmonary hypertension. The other thing is there's one medication that's called selexipag or In the US, it's called Uptravi, that has been shown to cause overactive thyroid in the main clinical trials. So physicians should be aware and check thyroid levels if they suspect that there's worsening of pulmonary hypertension.
Belarus, what exercises or types of physical activity would be recommended to start with for a beginner who does not have the opportunity to practice in rehabilitation programs? I guess we covered this before a lot with walking and all this. Yeah. Another question, quite intimate. Can women with PAH have orgasms? Many patients are afraid as this can lead to a worsening of the condition, as they think.
Anybody can have orgasm if there's no medical condition that, to my knowledge, that can affect the orgasm. It's for us women that the mind drives the rest of the body, and I think can suppress the feeling of orgasm or climax. And one way, as I said, to do it is find your own orgasm, because if you do it yourself, it's not going to be a whole lot of exercise, and you will know if you can achieve it and how much it needs to be achieved. And that's how you learn about your body.
Sounds a little sad thing that you have to be afraid of an orgasm, but I guess as a PH patient...
Don't be afraid of orgasm. Absolutely not.
I don't think so. Which hormonal contraceptives are best for women with PH? Many hormones can cause blood clots. I guess we also covered this.
Yeah. Going back to the orgasm itself doesn't consume a lot of energy. So again, don't be afraid to achieve that. It's the exercise leading to that needs to be maybe tempered or slowed or, dealt with.
Good point. Portugal, can patients benefit from psychological support to overcome the fear and anxiety about doing sports, having sex, and using of the contraceptions?
Yes, I absolutely think so. And we, at our center, we try to match, we talk about sports and exercise and contraception, but for sex, we try to match male patients with the male healthcare providers, female patients with the female care providers, to give them more comfort in opening up and telling us their fears, their worries, and so forth and so on.
Well, thank you so much. We're 5 minutes over time, but it's been really interesting, and you've been very frank and open about all these things and discussed it in a way that I never heard before. So I really thank you so much. And I think our audience have been very pleased, and these are interesting and important topics.
Absolutely. Thank you, Hall. It was a pleasure to be here, and I wish everyone the best, and hopefully we will meet in person very soon.
We definitely hope so. And I just want to tell the audience that we will start again tomorrow at 11. And once again, thank you, and see you later.
Have a good night, everyone. Bye-bye.
Bye-bye.